My question is for the Minister for Mental Health. We recently celebrated International Women's Day, a time to reflect on how we can accelerate action to gender equality. Women living in Casey experience psychological distress at a higher rate than the state average. There was a mental health and wellbeing hub at Narre to support people in Casey and Cardinia, and unfortunately that closed last year in anticipation of a mental health local opening in the area. 10 new mental health locals were due to be contracted nearly a year ago, including one in Narre, and it is my understanding they are still in the planning phase, which has meant that there is now no mental health and wellbeing hub or local to service Casey and Cardinia. So my question is, will the Minister ensure the delivery of a mental health local at Narre?
Minister.
Thank you, President, and I thank Ms Payne for her question and her ongoing interest in these important issues, particularly when it comes to the mental health supports for the whole community. But we do know that women face particular needs, and we have already delivered 15 locals across the state in both metropolitan, regional and rural locations, and the services have been able to support over 17,000 Victorians to date, some of them with the missing middle is what these services are designed to address and support people who might be, they might have a mental health condition that's too serious for a GP but not serious enough for an acute mental health service. So these are important reforms that the government is delivering. Interestingly, that 17,000 is skewing more towards women than men in the community so far. So in terms of your specific question around supports in your part of metropolitan Melbourne, the department obviously has been working closely with services in those areas. We have got a Dandenong local, which commenced services in December of 2023. There was a transition arrangement in place for consumers who were accessing the Narre hub to be offered the opportunity to transition over to the Dandenong local. For those that chose not to do that, there are still Commonwealth-funded Medicare mental health services, which used to be called Head to Health. They've just recently, the Commonwealth has rebranded them as Medicare Mental Health Services, and there's one in Officer and one in Berwick. But obviously, my department is undertaking a pretty comprehensive evaluation of the first 15 locals to take learnings from that, and we've also been working on workforce capacity and increasing the workforce pipeline, and that was a $15.8 million commitment in this year's budget to fund the graduate program to enable us to build that pipeline and obviously continue with the rollout of locals across the state. This is an important reform and we're getting on with that work.
Ms Payne, supplementary.
Thank you, President, and I appreciate the Minister's response. By way of supplementary, in the short term, community members are calling on the government to reinstate funding for mental health and wellbeing hubs like the recently closed service in Narre. This interim measure would address the service gap and ensure that people are not worse off than before. So will the Minister consider reinstating the funding for such hubs?
Minister.
Thank you, President. I thank Ms Payne for her supplementary. The way that the bilateral agreement operates between the state and the Commonwealth in relation to these services is that the hubs are funded through the Commonwealth bilateral agreement, and as locals are rolled out, those hubs are pulled back. So it's important that we keep the network in terms of both locals and hubs as we continue to build the rollout of future locals, but I'm very happy to keep you updated in relation to those issues in the South-East Metro area.